Most people think that high blood pressure gives symptoms, but what if I told you that you could have it for years and feel completely fine? And by the time your body starts showing symptoms, the damage may have already begun. So in this video, I'm going to show you 7 silent warning signs, and the most dangerous one is the last one. Before we go into the signs, this is important. According to national UK guidance like NICE, high blood pressure is often picked up through measurements, not symptoms. That means many people walking around today with high blood pressure have absolutely no idea. And these are not classic symptoms. These are warning signs your body may already be under strain. Let's start with headaches. Now, not every headache means high blood pressure, but persistent, especially morning headaches, can sometimes be a clue. Why? Because very high blood pressure can increase pressure in the blood vessels in the brain. But here's the key point. Most people with high blood pressure do not get headaches at all. So if you're waiting for headaches before checking your blood pressure, you may already be too late. Secondly, blood vision. High blood pressure can affect tiny blood vessels in your eyes, a condition we call hypertensive retinopathy. In fact, NICE recommends checking the eyes when assessing for damage from hypertension. So if someone notices blurry vision, difficulty focusing, or changes in their sight, it could be a sign the blood pressure has been high for some time. Thirdly, nosebleeds. This one is often misunderstood. A random nosebleed doesn't mean hypertension, but recurrent or unexplained nosebleeds can sometimes be linked to very high readings. Why? Because high pressure in fragile blood vessels, especially in the nose, can make them more likely to rupture. Again, this is usually in more severe or uncontrolled hypertension, not early stages. Number 4 is chest discomfort. Now this is where things start getting more serious. High blood pressure puts extra strain on your heart over time, and in some people that can lead to a feeling of pressure, tightness, or discomfort in the chest. But this is really important because not all chest pain is the same. Chest discomfort linked to high blood pressure is usually more gradual. It may come with activity, feels mild, and goes away with rest. But a heart attack is different, and you should never try to guess at home. A heart attack often feels like a heavy pressure or tightness in the chest, pain spreading to the arm, neck, or jaw. Associated symptoms like sweating, nausea, or shortness of breath could also occur. If you ever have a chest pain that is severe, sudden, or doesn't go away, don't wait. Call emergency services immediately. It is always safer to get checked than to assume. The 5th sign is shortness of breath. Yeah, this can happen when high blood pressure begins to affect the heart or lungs. For example, heart failure, fluid buildup, reduced cardiac function. So if someone notices breathlessness on exertion or even at rest in severe cases, it may be a sign that hypertension has already started affecting the heart. The 6th sign is fatigue or confusion. This is subtle and often overlooked. Very high blood pressure can affect blood flow to the brain, and this may present as unusual tiredness, difficulty concentrating, confusion, especially in older adults. But again, this is not early hypertension. This is often when complications are already developing. Now, the 7th sign is the most important sign, and that is having no symptoms at all. This is the truth about high blood pressure. Most people feel completely normal. No headaches, no dizziness, no warning whatsoever. And that's exactly why NICE recommends regular blood pressure checks, because diagnosis is based on readings, not symptoms. So what should you actually do? If your blood pressure in the clinic is 140/90 or higher, or home readings are 135/85 or higher, that's considered hypertension in the UK, and the goal is simple: early detection, early treatment, and this would prevent complications. The biggest mistake people make is waiting for symptoms. High blood pressure doesn't usually give you that warning. So don't wait for your body to tell you something is wrong. Check your numbers. And if you haven't seen my video on when blood pressure becomes an emergency, you need to watch that next because that's when things become life threatening.